to me. All right. Okay, that looks better. We're gonna share it from that window right there. Let's see, window. This is weird. Hmm. Content from camera. Okay, I think we're good here. All right. Okay, here we go.
Looks
I
good.
want to move you guys over here. All right. So we're going to be talking about the First Five Site Coordinator role specifically, and I am that lead currently for that infrastructure work that happens under the Site Coordinator umbrella. This series, it's a 4-part series, is intended to get you familiar with the Site Coordinator role, specific to um, resources, support, and areas of focus under that specific role and the responsibilities of the site coordinator. So we'll go ahead and get started. All right, so I call this the basics, even though it's you've already had that first 5 basics with Amy, kind of that overview of the program at that, high level. This is the basics of the site coordinator role. So Site Coordinator 101. We will be moving through the rest of the components of this training series pretty quickly. We're trying to get all this information under your belt before I transition out of the program in my role. So we will work on part 1 today and part 2 later this afternoon. And there's Amy and I, your first 5 consultants. So both of you are going to be working with Amy. She's your consultant. And Mickey is our supervisor. So you'll see her at the monthly calls. You'll see her at the consortium meetings. She is our internal resource and your resource as well for additional support in First 5. Our objectives for today is to really meet the First 5 site coordinator. We're going to talk about the First 5 contract. We're going to talk about the site coordinator guidance documents. You're going to get a real feel for the site coordinator role and what that role includes. We're going to look at that First 5 4-part model of implementation. So that might be some review from the basics presentation that you completed with Amy. And as follow-up to getting ready for this conversation today, we encourage you guys to review your contracts. So review your first 5 contracts, specifically focus on the description of work and services, and that includes staffing requirements and the specific areas of work under priority area 1, which is that infrastructure work with primary care practices and providers. Area 2, which is at work with community providers. Access and referral resources are another topic under that description of work and services, and the presentation topics that you guys will want to consider when you're working with your infrastructure partners. We also encourage you to look at the appendix in your contracts. So that will include the professional development and training requirements. There you will be focused on the site coordinator role only, because today we're going to be just talking about that specific role. And it's not new anymore, but we did add emphasis in the last contract and RFA period to include a focus on public speaking as a part of your professional development and virtual presentations. So those are areas of focus that you'll want to explore in your professional development and training opportunities for your role as site coordinator. That could really help with delivery of your infrastructure activities for priority area 1 and 2. And then we will always encourage you to connect with your site coordinator guidance documents. The guidance documents for the site coordinator role are located on the MCAH project management portal. And so we'll look a little bit more at that portal. But that is where those guidance documents are built out for site coordinators, and they're sectioned out into areas of focus. So the first area of focus to kind of get you ready for today's conversation is that focus on surveillance and screening. So you'll want to move through those guidance documents one at a time. Take a look at those guidance documents, and then you'll be returning to them throughout your tenure with First Five, because you won't know kind of how all this fits together quite yet with how new both of you are, but that is a living document that you'll want to return to as you grow in your First Five site coordinator role. I like to talk a little bit about the mission for Iowa HHS and make that connection for you guys in terms of how First Five fits into the mission of Iowa HHS and kind of how that makes sense. Iowa HHS and their mission is to provide high quality programs and services that protect and improve the health and resiliency of individuals, families, and communities. And so when we hear that, that should make you think about our work with families, right? Our work with communities in First Five, and the resiliency of individuals. So First Five really stands up the supports for children and families to get connected to on the heels of developmental screening and primary care as a way to identify those children and that need to be connected, and their families that might need additional support to prioritize that focus on developmental support. So First Five does fit nicely into the Iowa HHS mission. And if you have questions from your practices and providers about why First Five, is an Iowa HHS program, you'll want to lean into the mission, right? Lean into how these things fit together and connect those dots for your partners. So that's why we start here as a place for understanding about your role, because you'll be making those connections for your partners as you work with them. All right, so where do we start with the First Five basics in terms of the Site Coordinator 101 series? So all roads lead to the contract, right? The First Five contract and or the request for application or the request for proposal. So those are big acronyms for the procurement process for figuring out who receives the contract. Every so often, for delivery of First Five services at the local level. So where is your contract located and how can you access that document? So you should already be in Iowa Grants, and you'll want to familiarize yourself with how to get to your grant site for First Five. The contract is located in the Contract Documents tab or section of your grant site. So hopefully you've submitted tickets to get into Iowa Grants to be a user. If you haven't yet, definitely work with your project director on how to access Iowa Grants, because you'll want access to these contract documents. Until you have access to Iowa Grants, because that can be a little bit of a process, you'll want to work with your project director for copies of the contract. And I definitely think that you should have a paper copy and or an electronic copy, so that you can do searches and have that document ready, because the contract really underscores the purpose for the work and the role of the site coordinator, the role of the DSS, all of the moving components of the work that we do in the First Five program. So that's where that document is located, but that document is big. All right, so the contract is big. The RFA and the RFP are lengthier documents, but the contract is big and can be quite dense. So today we're going to be looking at specific information that I want to draw your attention to in the contract right now and right away to become familiar with your role. So we recommend looking at Article 6, the description of work and services. That is where the bulk of this information begins in the contract. And we'll look at the staffing requirements, priority area 1, priority area 2, access and referral resources, presentation topics, and the appendix. So we're going to go through these in a little bit more detail, and I'm going to pull some specific information out for you guys to familiarize yourselves with so that you can keep these things in mind as you become familiar with the role and figure out what that role looks like in terms of what should I be doing per the contract. We always want to connect back with the contract to make sure that we are doing the work that the contract outlines, and we're fulfilling those obligations within the contract that we have signed for this work. All right. It is an expectation that contracting agencies know the terms of the contract. So yes, you may not sign the contract, right? Your site coordinators, you are a component of the work. And so very high level signage of the contract is required, right, to receive First Five funding and to deliver services for First Five. But you as site coordinators are responsible for knowing the terms of the contract as well. So make sure that you read through the contract. If you have questions about the contract, definitely reach out to myself or Amy for clarification. And you'll want to cross-check the work that you're doing does align with the contract. You will want to do that periodically. I know as a new site coordinator, I was unsure of whether a certain activity aligned with what the contract says I should be doing. That is definitely a perfect moment to cross-check against the contract. Is this in the contract? Does this fit in my scope of work? Is this appropriate for me and my role? The contract is definitely a guide for you to make sure that you are on the right track. All right, so we're going to dive into page 6 of the contract, and we're going to pull out some really important language under that scope of work and services, right, in Article 6 on page 6. And we're going to just have you think about these things as we kind of talk through them. So things that we want you to know right away about your role. You serve as the primary point of contact for all First Five activities, including primary care provider and community partner outreach and training. So you are really that hub. You're the hub for First Five activities, and especially the hub for connections with your primary care provider population and your community partners, right? And your CSA. You provide outreach to those partners and you provide training to those partners as appropriate, right? Within the terms of the contract. So you are that hub for all First Five activities. You work directly with primary care practices on the First Five initiative. That also includes working with individual primary care providers and office staff in the primary care clinics. So you could work with office managers, care coordinators internally, social workers in the practices, patient service representatives, which are called PSRs, that do some of that coordinating on the front end of clinic operations. You are the person that works directly with that population of primary care individuals and professionals on behalf of the First Five initiative. You implement the First Five model with fidelity and lead the contractor's efforts to assure that all staff and subcontractors adhere to the First Five model. That kind of sounds scary, right? Oh my God, I'm responsible for making sure everybody's doing what they're supposed to be doing. That's a big lift, Brandy. And I understand that that is a huge lift. But it does make sense that when this role is working directly with the partners that we impact the most, right? And that being primary care providers, where screening is recommended in those primary care spaces, and with community partners to partner with them around understanding the resources that are available, how that referral pathway works, making sure we have a warm handoff to those referral resources. It makes sense that you are that connection point for for ensuring that the model is being implemented with fidelity, because you guys are the ones that are building those relationships. You're building them in the community, you're building them with your DSS internally, you're building those relationships with your primary care partners. So you guys are really the leader, and are responsible for ensuring that the model is being understood by those partners, right? Because you're going to be teaching and educating those partners about the model. So you're ensuring that there's fidelity there, but you're also bringing your internal teams along with you for them to understand the why behind how some of these contract requirements work. And that is due to the model, right? So all roads lead to the contract and all roads lead back to the model for First Five. We do X, Y, and Z in this process fashion because it supports the model. And that supports the purpose of the program and helping us to be successful in implementing the program at the local level. So program fidelity is very important. We lean into the model for that support and guidance. And you will be working with your internal and external partners to make sure everyone has an understanding about that model, why the program operates the way it does, and how you can help them to ensure that the program is being implemented with fidelity, right? So you're that support as well. The site coordinator spends a minimum of 0.30 FTE, which is a minimum. So to me, the 0.30 FTE doesn't really tell me much because I am not a math person. So I'm like, that sounds great, but what does that really mean on average for a work week for me? How much time should I be spending in this type of work? Give me something more concrete. So a minimum average of 12 hours per week on Medicaid EPSDT matchable infrastructure activities. Which are those activities when you work with primary care practices and providers and your community partners? That's the minimum. So I say that as a caveat because your contracts with First Five may have your infrastructure time at a much higher percentage than 0.30, right? FTE. That is just the minimum. So I share that because you know that all of your fellow site coordinators across the state are putting in at least 0.30 of an FTE into the priority areas 1 and 2. So everybody is doing that work. It is a required essential component of First Five delivery at the local level. And so it's important to talk about that minimum requirement in the role. It's very important to the success of the program. Infrastructure activities must be tracked and documented, and you guys determine internally in your agencies what that methodology and process looks like. And that sounds like a big lift as well, right? So you're telling me, Brandy, that when I go and meet with a practice or I go meet with a provider, that I have to track and document those things. Absolutely. That is crucial to knowing how your relationships and partnerships are growing, right? Because you will be working with a lot of practices, a lot of providers, and all of them are at different places with First Five partnership. The only way to know if what you're doing is successfully moving them to partnership with First Five is to track and document those interactions, those conversations, the area of focus for that time together. So it is a requirement of the contract that the site coordinator role documents infrastructure activities with their priority area 1 partners, right? Those practices and providers, and also with their community partners.
I want to jump in to say that I would check with your project director on that. I know some sites might have like a tracking sheet, a time sheet, time studies that they complete. So make sure you check with your director on how you guys are tracking and documenting where your time is spent for those activities.
Absolutely. All right. You carry out the contract terms and conditions, including but not limited to effectively communicating with HHS, with us, and responding to HHS requests and reporting requirements. So you are that link for Amy and myself, for Mickey, to share back information with your team, right? With your project director, with your DSS about HHS requests, and you are making sure that those reports and Iowa grants that are a part of the contract are getting completed. So you really are that liaison between your contracting agency and HHS. This is that role. So you're going to fit nicely in that role, and you're already developing relationships with Amy and myself before I transition out of the program. But we are going to be leaning on you and sharing information with you. And it is up to you guys to share that information back with your internal teams for First Five. And you, again, to kind of echo Amy's recommendation for checking with your project directors, check with your project directors on the process for communicating things back to the team, right? How does your team communicate HHS requests, HHS information about First Five back to the teams? What is that protocol? What's that process? What does that look like? Because Amy and I will be communicating directly with each of you via email or phone or these kind of virtual spaces, and you will be probably wanting to communicate some or all of this information in some way, possibly back with your teams. But your teams will determine what that looks like internally. So work with them to understand what that looks like for your team. All right, that seems like a lot. It is just a kind of a high level look at some of the important things we want to pull out right away as you get situated in your role in terms of what this role looks like and the um, landscape of the role really is what we're trying to help you kind of wrap your head around. So a question for you, what themes are you noticing in the description of the site coordinator role? What are you hearing? What's resonating with you? Is there anything that's scary? Anything that you're excited about? What themes are you noticing in terms of the description of the site coordinator role?
And you are in a safe space. Oh, I think
Yes.
Ashley, I think you're muted maybe.
Yeah, I can't hear you at all.
No, not yet.
Wendy, if you want to go ahead, you can, and we can
Mm.
come back to Ashley when she's on the mic.
I think about, I think the biggest theme is what you just spoke about, being grant driven
Mm-hmm.
and being cognitive of everything in that grant.
Mm-hmm.
Um, I feel like every day, there's one more thing that I'm learning. I'm going back to the grant, and because of all of that, I've made a binder that just says grants.
Awesome.
And
Smart.
I've got everything in here. I've got it all the grant printed out. I even printed out the year before to try and compare and contrast. And
Very good.
that's the biggest theme I see here is just the grant drives my job, my role.
Yeah, double checking that, cross-checking the actual work against the contract and the purpose of the grant, right? Are we meeting that goal? And how does the work support the goal, right, of the grant? That's really that full circle look at your role and kind of how that all works together, right, with the grant pieces. That's absolutely true. Awesome.
Okay, can you hear me now?
Yes, perfect.
Okay, great. It had defaulted to a different mic, so we are good to go. I I don't know. I keep thinking of almost like a beehive in my mind, like just lots of different types of bees doing different jobs with the consensus of pleasing like queen bee. Um, and just right now, personally, I'm trying to just take a lot of notes. I have not had a lot of time with Paula, my director, so I have kind of a list of notes and then kind of notes of like reminders, things so I can debrief myself after these meetings, of like what needs to be done, what needs to be asked. So then when I am learning it, I can be like, oh, this is what they were talking about. And so yeah, just trying to take it in and relearn this part. So
That's awesome. Awesome. Well, thank you for sharing. And you're right that we all work together and all have very kind of unique roles to play to make sure the whole program is working successfully, right? Because without the site coordinator role working, right, under that PA1 and PA2 umbrella, then providers don't know about us. Providers don't know that we are available, that we can help with developmental screening. But on the other hand, if we don't have a strong awareness of the resources in the community, and we don't have quality DSS services, right? And that good relationship with our DSS staff, it doesn't matter if we're out in the community making those good relationships, if on the other end, when we get those referrals, that falls apart, right? So everything has to work together and everybody has their own focus. And the site coordinator role is essential. It's that you guys are Amy and me at the local level. So I'm just going to call it what it is. You guys are Amy and me at the local level. You represent First Five at the local level. You'll be experts in the program purpose, why we do what we do, why we're important, how we work together, how we can support the providers and the practices, what the DSS services look like, right? You are going to be that well-rounded First Five program expert that your partners can lean into. And it's just it's a very unique space and it's a very dynamic and exciting role to have. Amy and I were both site coordinators for some time at the local level. So there is no silly question. We know what you're going through. We know all of this is very new and may not make sense. Lean into us and ask us questions, and we can help you with clarification. We have been there too. So yes, absolutely. Your comments are spot on. All right. So
And I will
this is,
also add
yeah,
that it takes time to be that program
yeah,
expert. It takes a
it
lot
does.
of time. So don't expect yourself to, sit here and absorb everything. You're going to absorb bits and pieces, and you're going to hear
Mhm.
us kind of repeat some of these. And I'm seeing this, and I'm like, oh, I said that yesterday. And so you're
That's
going to
okay.
like hear a lot of the same things throughout our trainings, and so you'll start to pick up on, oh, that must be like a really important piece because they've said that like 3 times during their
Mhm.
trainings together. And so it will start to fall together, and you'll put those pieces where they need to go, but just takes some time.
It does. It takes time. Takes time. I didn't even know my way around a hospital. I couldn't find any of my provider's offices. I'm terrified of the doctor. I have white coat syndrome. And I was in a hospital trying to tell providers they should do developmental screening. And so there's times when you're just going to have to fake it till you bake it. You won't know all the answers, but you can say, I'm not sure about that, but I can get back to you, right? I will find the answer and I will connect back with you. How can I get that information to you when I have it? What's that best method? So it's okay. Everybody's starting out. This is a very unique role. And so you guys I'm just excited for you. You guys are in a great program. There's lots of success here, and lots of success to be had. So I'm super excited for you. Our model is what I call the guide to our North Star. Our North Star is to increase rates of developmental screening in primary health care. That is the goal of the program for First Five, to increase rates of developmental screening in primary health care. The model supports priority area work described in the contract as a method to get to that goal, to set you up for success, to make sure that you are successful in implementing and getting to that goal. So the step 1 is the provider screens the child. Step 2 is the provider refers the child. Step 3 is that first 5 makes that connection. And step 4 is that first 5 follows up with a provider. The model components are important again because they outline the why we do what we do in first 5. So if you have challenging partners, and you will, like, why can't you just do this? And it's just it's what I call the CYJ. Can't you just do this? No, we can't. And then so we lean into the model. And then that is a good opportunity to review the model with your partners. And so the model you're going to want to lean into for those tricky situations, those tough conversations, because the model is that helps us get to that North Star, that program goal. Other things to know, the model language is accessible at a 6th grade reading level. So it is accessible to all of our partners, regardless of whether they're a provider or they're a community partner or they're the public, right? So we had all those things in mind when we were updating the model. The model drives engagement flow and partnership expectations. So if you're not sure what the expectations, oh my gosh, it got dark. Hang on just a second. I'm in a timed room with light. Hang on. Hang on just a second.
I'm gonna add, because you guys aren't gonna get to see this when Brandy leaves, but she's a big like hashtag girl, and like she creates these little sayings. So what was it? Can you just
Hashtag
CYJ.
can you just CYJ, right?
So this is
You
something that I love about Brandy because she creates these little things that stick to you, and everything's a hashtag. I love it.
So I have lost the window. I only got the window with the slide in. I lost you guys.
Oh,
I'm
I
trying
hate
to
when
find
that
you.
happens in
Oh.
Teams. I wish I could help you, Wendy. I don't. Sometimes that happens to me too. There, yeah. I think that's the easiest way is to
Bump out and
jump
come
out
back
and jump
in.
back in. Yeah.
Yeah,
Give her a minute to come back.
absolutely. Absolutely. I think I'm going to make this a little bigger so I can see. There we go.
Okay, sorry.
Yeah, there you go. Can you see us now?
Okay, yeah, you're back
Awesome.
on, but
All
you
right.
left, or I don't know what happened, but
That-
it's back. Sorry.
That's okay. Totally okay. I apologize for the sweeping darkness here. It's just kind of a time sensor, and it's technology is super funny. Okay, so we were talking about how the model drives engagement flow. So if you are working with a partner and you're not quite sure where to start with them, what the focus should be, we need to look at the model. That's a great opportunity to take a look at the model. Okay, I work with the provider, right, on developmental screening. So there's going to be training, there's going to be conversation. Right? Because we want the screening set up to encourage referral for needs that we identify in that clinic, in that practice, based on a screening and or conversation with the family about the needs for the child. And then we kind of walk through the role of the DSS, kind of what that looks like. How can you support the DSS in their work? And then also, what are the follow-up expectations with the primary care provider, that really core partner? What does that look like? And so you'll want to lean into the model for reminders of engagement flow and partnership expectations. They are all built in here, really clear. And if you have any of those pushback conversations, the CYJs, you just want to pull out that model and you want to review the model with your partners to explain the why behind how First Five operates in terms of that model. So you'll see the model quite a bit, and we have just updated it. Did we update it this year, Amy, right? So Yeah.
They
For
got
pr-
a sneak peek at the old one. I don't know what document we were
Yeah.
looking at that
Yeah.
we got to look at the old one and it was like, whoa, blast from the past.
So different. So different.
Big
Yes.
improvement. Big
Yeah. Big
improvement.
improvement. All right, what are we looking at next here? Okay, so we're going to look at a little bit of a deeper dive. I keep talking about priority area 1 and priority area 2, or PA1 and PA2 for short. These items are specific to pages 8 for priority area 1 in the contract and pages 10 for priority area 2 in the contract. These are the items that I want to pull out for you that will help you further understand what those expectations under that infrastructure umbrella will look like specific to each type of partner, right? Each partner population. So the big three that I pulled out under page 8 for priority area 1, and that's that EPSDT matchable infrastructure work. And do we all know, and Amy and I sometimes forget that these terms are new for our partners, right? For you guys. EPSDT matchable. So First Five receives funding, right? A specific percent of our funding from Medicaid match. And what that means is we get funding from Medicaid to directly with providers that are EPSDT. So early periodic screening, diagnosis, and treatment is what EPSDT stands for. Though that is the Medicaid benefit in Iowa for children up to, I think it's age 18. I think it's 18. So we get money as a program from the state of Iowa from Medicaid to connect with, train, and work with Medicaid providers that see children for well child exams. So that's why we call this EPSDT matchable. It is a required part of your work. So I think that kind of helps to kind of shore up the meaning of that. We don't just throw that around. It is intentional and it does reflect back to our funding and kind of who we work with. So
I'm gonna add
PA1,
the
yeah.
Iowa EPSDT website in the chat just because I think that's really helpful to
Good.
see how the developmental screening piece fits
Yeah.
into their work. And that's why
Mhm.
we get funding to help them in those activities because we're all working
Absolutely.
together towards the same goal.
Mm-hmm. All right, so you are going to be working on improving rates of engaged practices in your CSA using the levels of engagement framework to move practices to what we call a level 3. We will be going over that levels of engagement framework, so don't worry if you've never heard that, have no idea what that is. We will be talking about that as a part of our 101 series. So later this week, we'll be talking about that framework. But what we need to know right now is that your goal is to improve rates of engaged practices in your CSA that are progressing to screening and referral to First Five. So you want to engage with them, you want to train them, you want to provide the screening tool, you want to show them how to make a referral to First Five, and you want to support those referrals from that practice, from that provider, and get those kiddos and families connected to services. So we want to move the providers and practices through that process, and we have a framework to help your role, the site coordinator role, progress through that that relationship to reach screening and referral to First Five. So that is one of your very important goals under priority area 1 activities. You're also going to be working on your work plan timelines, meeting those timelines and targets, and only accepting referrals from primary care providers that complete well child exams where screening is recommended to occur. So that's something really important to pull out, that we work directly with primary care providers that see children for well child exams, because that is where developmental screening is recommended to happen in those spaces per the Iowa, per the American Academy of Pediatrics. So that's recommended. We want to help those providers get that in place and provide them with a referral opportunity if and when needs are identified within those screenings. Now, your work plan timelines, you'll want to look in your grant site in Iowa Grants. You will have work plans already approved, or we're working on approving the work plans from January 1st this year all the way to the end of June, the end of our fiscal year. And you're going to be working on those work plans, those timelines and targets, and completing those as you can, right? That's going to be a priority for you. And then you're going to use promotional items appropriately in those work plans and within those activities. And that is that information is also outlined in the contract in terms of what promotional items are appropriate and what promotional items are really, we found, not helpful to developing relationships and moving the needle on developmental screening and primary care. So you'll want to take a look at promotional items as well in terms of the language of the contract. Under priority area 2, that's working with our community partners. So we're going to switch from working with that primary care focus to our community partner focus. Two kind of big focus areas that I like to pull out, especially kind of on the front end of getting to know your role in this work, is that you're going to be reaching community partners within all eligible counties in your CSA. So there is an expectation that you either have a community coalition that you work with, or a community partnership group that you attend, in all eligible counties in your CSA. And so for both of you, I don't think you have any ineligible counties in your CSA that receive First 5 services. So all of your counties, you'll want to make sure you're connecting with those community partners and making sure that you're visible. First 5 is visible in those counties across your CSA. There's awareness of First 5, awareness of our model, awareness of how we partner with our community partners to make sure that the services are provided to the referrals that we receive from primary care. You're going to conduct community outreach activities compliant with the approved activity calendar in your grant site. So there is an activity calendar that has been approved that was submitted by your previous site coordinator to really outline, and this is we didn't ever used to have these tools, you guys. So we kind of used to have to just list all of the meetings that we would attend, right? The frequency of them. And it was very difficult to kind of track. It was very archaic and just very difficult. What we've done since then is we've actually implemented what we call an activity calendar for community partners that lives in your grant site. So as a part of the application process every year for funding, agencies will submit a calendar of activities in terms of how they plan to make sure that they are connecting with every county. So they'll list all of their community coalitions, community partnerships, and the frequency of those activities are really listed out nicely in your grant site. So that would be a good resource for both of you to take a look at. If you need help locating that, we can definitely take some time to kind of walk through where that would be in your grant site. You'll want to pull that up, save it, and or print it so that you can make sure you're continuing, right, to connect with those same community partners that your agency has historically met with, and making sure that you're not missing, right, any of those opportunities. So we can talk more about that if we have time today. Otherwise, Amy and I can send out follow-up about where that would be to make sure you have access to your activity calendar for your agency. And there's also within that work plan that's been approved, there is an approved community partner presentation work plan. So the good thing about being a new site coordinator is that you're learning about the work plans, right, that have already been developed for your agency. So you already have kind of a pathway for how to work with your partners. The tricky thing is making sure that those activities and those timelines work for you and you're able to complete them as planned. So that is the tricky part, and that's kind of what we're trying to get you ready for. But you do have kind of a carved out plan for what you're going to be presenting to which community partner group, what topics. And typically there's like 3 or 4 core topics. That's first 5 basics. Who is first 5? What do we do? The topics about the model, kind of how our program operates, and then also partnership expectations, how we partner with other community groups and what that looks like. And then those presentation topics are listed on page 11 of the contract. So you can take a look at what your options are for working with your community partners as a place to start. But you do have those work plans already approved for what you will be doing kind of moving forward. All right. So the contract was the first really essential resource to learning more about your role. We focused a lot on that today. The next really important resource are going to be the site coordinator guidances. And so what are these guidances? Our guidances for site coordinators are documents that are designed to support your understanding, so site coordinator understanding of First 5 programming and your role in implementation of this work. This information is also recommended for project directors and agency administration that would like additional information on the site coordinator role and work. So I've added that second bullet point because it's not just important for you to know the expectations of the role and the resources you have access to, terminology, the partners you'll be working with. It's also helpful for your project directors and other agency admins to know about your role and kind of what's expected. Amy and I, when we were site coordinators, had none of this guidance. We had no guidance documents about what this role did, the expectations for the role. And so we've really built out specific guidances on first, surveillance and screening. So what is surveillance as a process? What is developmental screening as a process? What are the differences between the two? And how do I talk about that with my providers? How do I get them on the same page? How do I train them and teach them about these concepts? Where are they starting from? Things for you to think about. North Star to increase rates of developmental screening in primary care. So that is the first guidance that you'll see in that kind of bucket on the MCH project management portal. The next one is going to be the levels of engagement framework. So you'll see that kind of listed out. All of that framework will be there. What are the levels of engagement? How can I use them? What are the different partnership types? What types of activities should I consider when using the framework? That is there as well. And then there's also a guidance section on infrastructure activities specifically. So specifically, how do I work with primary care providers? What kinds of training should I do? What should I think about when going into a meeting or a training? What does that look like? What kind of tools should I have ready? What kind of questions might I be asked? So we've really built out all of these guidances to be huge resources for this role specifically when engaging primary care. And also some of this is very appropriate to working with community partners, right, around surveillance and screening. And why does First 5 focus on surveillance and screening? And why do we think it should happen in primary care instead of, home visiting or at early Head Start, things like that. So this is going to be your next resource that's going to be essential to you really kind of shoring up your confidence in the work and being able to move forward with your providers and practices. So where is this document location and how can I access this document? So it lives on that project management portal. It is a safe and secure link. And I want to click here and see if I can show you this, kind of where this is. so that you guys can see this. All right, so there's site coordinator guidance in the sections right here. They are 3 large PDFs, right? So there's surveillance and screening, levels of engagement, and the matchable infrastructure section. So we can go to screening and surveillance here. And so it popped up with a table. Maybe I was at this table previously. But there are sections here. There's a table of contents. There's our old model. Look at that. There's our old model right there. We have come a long way. So some of this needs to be updated, but the information and the content is still very helpful and is appropriate for you. So what is developmental monitoring and surveillance? What is screening? How to know the difference? How to know what is being used in a practice? How to talk about that? How to feel that out? How to unpack a screening tool for your providers, the two-step approach to training providers on the ASQ, and kind of walks you through that recommended approach to training your providers on the ASQ tool. How to approach training on the MChat tool. There's references and links to attachments. So these are great resources for you to investigate. I would say that you will not all of this will stick right now. Even if you were to invest considerable time, right, in reviewing it, it's not all going to find a home in your brain because you're just getting used to your role. But it might flag an awareness later if you review it now and later you're out in a practice and they ask you, so what is the difference between surveillance and screening? And you're like, oh my gosh, I remember a table in the guidance document that is a tool that I can print out and I can go over that with my providers. So there are things that you'll want to earmark for later use once you kind of figure out what you're needing in your role and kind of what gaps you might need to fill as you learn about your role. Okay, let's stop sharing that so I can close that up. Okay, any questions so far? Any questions?
I have just been taking my notes of things I need to ask about, and so I will probably touch base with Amy later.
Yeah.
As far as if they're Amy questions or Paula questions, because that helped me yesterday when I was debriefing to know so I don't waste your time and or Paula's time. So
Hey, yeah, so there will be a part of the training where we'll ask you to reply back to confirmation that we completed the training in an email, and you can add any of your questions to that email if you have any at that time. That is a good way to record that we all had the training. You can save that email, and that's kind of goes into your training bucket, tracking your trainings, and you can share that with your project director that I did complete these, and we can add them to our project director tracking of your training. Okay, what is going on here? Do you see that spinning circle? Is it spinning for you too? Yeah, okay, so it's not just me. Okay, good. Very good. Let's try this again. Okay, we're going to escape and we're just going to go to the next slide. Let's just try this. Okay. Okay, that looks a little better. All right, very good. Okay, that looks a little better. The spinny thing is gone at least right now. Okay. And we'll just make it big. Here we go. Then I'll move you over so I can see everyone's pretty faces. Okay. Okay. All right. That is so weird. We're just going to go over here. Jeez Louise. What is going on? Oh my goodness. Maybe I'll just make this big since it won't It won't load for some reason. Okay. Okay. All right. So let's get into cues about this role on in the RFP and the RFA. You'll want to earmark this for later. The RFP is our process. It's our competitive process for identifying our grant holders for a project period. So it's competitive, and it outlines our project period and RFA cycles within that process. We are in an RFA year right now, and we will be posting our RFA in February. So there will be applicants that will complete the application and let us know kind of what they plan to do for the upcoming project year as a part of the RFP cycle. In the RFP, and that also lives in the Iowa Grants grant site. So that's part of the attached documents, I believe, in that in the grant site. And this is specifically taken from the RFP on page 28. And I just pull this out because these are high level things to think about as you think about your role and as you describe your role to others in terms of what you do and kind of your responsibilities. So your role functions very high level as the first 5 subject matter expert. So you're the subject matter expert on the model, on the why of First 5, the program purpose, the roles in the program, and how you can assist primary care providers in meeting screening goals, in meeting referral needs, and also supporting community become involved with First 5 by being a resource, right, for those referrals we receive from primary care. You are the lead communicator and facilitator. So for overall First 5 operations and CSA partnerships, I love that, lead communicator and facilitator. So you are the lead with communication between HHS and your agency, like we said, but also the lead communicator for those public facing, right, engagements and partnerships with your primary care partners, your community partners, the public. So lead communicator and facilitator, right, for trainings, for educations, and for those spaces where you engage your partners. And that includes and all of those CSA partnerships. You're responsible for establishing a First 5 leadership presence within the CSA. Amy, I love this language that we developed, and I haven't seen this for a while, but I think it is perfect. It is a leadership presence, right? So we talk about First 5, you are present, you're visible, you're that public facing connection between First 5 and HHS. So you are the presence for First 5 in your CSA. And your primary areas of focus, again, are within priority area 1 with those primary care providers, priority area 2 with your community partners. Those are your primary areas of focus. Not to say that you won't maybe have some work or some FTE possibly in DSS support and or administrative activities, but these are your primary areas of focus in this role. So what does this mean? And what do we hear in terms of what the overall kind of large, big picture documents that drive the grant processes for First 5 around the First 5 site coordinator role? We hear leader a lot here, right? Leader, leadership. We hear expert. We hear communicator, facilitator, and partnerships. So what this tells me, and I hope what's being conveyed to you and is pretty clear, is that this role is very much centered on relationships. It's about building relationships and rapport with your primary care providers and your community partners in your CSA. And I don't know why that just did that, but maybe I'm grateful because maybe this will work. And I would be happy with that. Look at that. Look at that. It just needed to reboot itself. That's totally great.
Hey, Brandy, I
Yeah,
have a quick question. Are you going to send us the slides?
absolutely. Yes.
Okay, I've been writing a lot down, but then I thought, well, maybe if you're just
Yeah.
gonna send them, that'd be better.
Absolutely. Yep. I'll be sending the slides and an ask for you guys to reply saying that you don't have any questions and you understand the content currently, just so that we can track that we completed the
So
training.
that's what you
Yeah.
meant. Okay.
Yeah.
All right.
Yep.
Or if
So
you do have
really, yeah.
questions, you include the questions.
Please include as many all questions as you have, and we will get right back to you. It's just a great space to say, yep, I'm looking at the slides and I don't really know about this, or yeah, this is piqued a question. So yes, please send questions if you do have them. Then that doesn't mean that the window closes for questions either about this part of the conversation either. It's just a nice space held for questions if you do have them.
Oh, okay, I'm sorry if you already said that you were sending these slides out. I didn't catch that.
No, that's fine. That's definitely fine. So really this role is very centered on building relationships within your CSA across these partners, being able to communicate the first five model, the program goal, and that means that you will be wearing that expert hat in a lot of ways, that first five program expert hat, and you'll be doing a lot of communicating, either in person, right, with trainings. You might be doing them virtually. You might be doing, you'll be sending mail possibly. You'll be definitely emailing correspondence, trying to get connected with your partners, but you'll definitely facilitating that communication and building partnerships within and across your CSA. That's what I love so much about this role. There is never a boring day in the site coordinator world, and there's lots of opportunity for feel-good moments and success. And so we are very excited for you on your journey in this very unique and special role in First Five. Okay, so what does this site coordinator actually do? What do we actually do in this role? All right, so number one, you train and educate. So you are the content expert. We've kind of already said that. You will be training and educating on developmental screening. So that includes implementation of the tools. It includes training and education on the First Five referral protocol, how to make a First Five referral, what that looks like, what needs to be included, what the follow-up for that referral looks like, all of those expectations around the referral process. You will be training and educating on practice transformation and workflow mapping. Practice transformation is a fancy way of saying that you're going to support practices with enhancing their protocols for incorporating developmental screening into their processes. And workflow mapping is a fancy way of saying you're going to help the practice with figuring out what that looks like. You're going to help them with figuring out what that workflow could look like to incorporate screening and referral into their current processes. Number two, you're the resource hub for primary care providers. They will see you as a connector, not only for them, right, to developmental screening support and education, but also a connector for their clients, right, their patients. So you are the connector. You will be connecting them to training and education, right, through your own partnership with them, but you will also be providing them an awareness of screening tools, of surveillance, of resources in the community for their patients, and making those connections on behalf of the DSS services that First Five offers and provides. And number three, you are an access point to additional healthcare resources. So what that means is your support. You are support for primary care in terms of Number one, peer consultation. We'll talk about peer consultation a little bit later in your training series when you meet with CHSC, Child Health Specialty Clinics. Peer consultation is one-on-one or one-on group, direct support from one provider to another. So it's bringing another provider in to help a clinic or a provider to incorporate screening into their workflow and referral to First Five. Sometimes we can say something as best we can, but we're not providers. And sometimes a provider needs that peer-to-peer provider support to move in that direction. Sometimes they need a peer to say, hey, this does work. I've worked with First Five. You can trust them. Sometimes that's what we need. So you will be a connection to peer consultation. You'll also be a connection to pediatric healthcare education through CME and CEU opportunities that are provided through our relationship with CHSC. So CHSC facilitates webinars for First Five annually as a part of our contract with them. And those opportunities are available to the providers and primary care practices that we work with across the state. So they can attend those educations virtually and receive CMEs and CEUs to continue to practice medicine. And so that is additional support that you will be offering your partners in the field. All right, so what does this mean and what do we hear? So I don't know about you, but a lot of these branches of the work that the site coordinator actually does includes being a leader, right? To train and educate, you're going to lead that conversation. You're going to lead that work. You are the expert and provide expert support. Again, you're a communicator, a facilitator, and a really good partner, right? Identifying what training is appropriate and can be helpful, what connections we can make for the practice and or the child and family, and what support the practice might need to move to screening, to move to referral, to assist their patients. So all of this, again, leads to relationship building. Regardless of what you're doing, you are building relationships, you're building trust so that we can implement developmental screening in primary care and get kiddos connected to the supports they need through that process and their families to better prioritize those developmental needs for their children. So again, relationships are a big focus in this role. All right, how much time are spent on these activities that we've been talking about? And so for training and education, to be the resource hub and to be an access point to additional healthcare resources. So to be the expert, to be the connector, to be the support, all of those are under that infrastructure activity umbrella. We would consider all of those things to be infrastructure activities because it's exactly like what it sounds. Those activities are the building blocks, right? They provide this structural support to the relationships, right, that are needed to move those providers to screening, to move them to a new resource they may not be aware of called First Five that can provide their patients with connections to community supports. So those infrastructure activities and primary care practices and partners are going to be, again, a percentage of your time, that minimum of 0.30 FTE, but you'll want to check with your project directors about your infrastructure percentage of time. What is the expectation in your role at your agency of how much time you'll be spending working with your community partners and your PCPs? So you'll want to know what that looks like so that you are making sure to spend that time and tracking that appropriately as you complete those activities.
And
Uh,
if your project director is not sure, just because it's been a
Yeah,
while since they've completed that
yeah,
form, you can
yeah.
find that in Iowa grants
Mhm,
in the staffing form where we
mhm.
list the project director, site coordinator, DSS, and within that form, it'll break down how much time you guys have allocated to each of those roles, including DSS. So you can find that there in case your project director is like, I'm not sure.
Mm-hmm.
That's where it will be.
Yes, very good. All right. And then what does this mean and what do we hear? So we hear about interactions with partners, right? The role expectations for the site coordinator really does include interactions with partners ranging from training, education, to various kinds of support. So you will be an expert, you'll be a connector, you'll find additional supports that are needed. And a lot of that is based on the relationships that you're going to be building in and across your CSA with your partners in this work. All right, so congratulations. We made it through Site Coordinator 101 Part 1, the basics. So we learned about contract description of the site coordinator role. We learned about the resource documents that will be helpful to your role, some of those role expectations, and the introduction to the first 5 models. So we looked at that as well. Next steps are that you're going to receive a confirmation correspondence of the completed training via email. So I will be sending that out today. Please reply via email to confirm the shared understanding of today's training topics as reviewed together. And then you'll include any questions that you have from today's training. And our next step is going to happen later this afternoon. So I will give you a break from Amy and myself. You'll go have lunch. You'll kind of consider what we've talked about. And the next step today at 3 is to talk about the partners you're going to be working with. And I love this one because it's got cute little caricatures of the different partners that we work with, and they are so cute. But we're going to do kind of a high-level overview of the types of partners that site coordinators work with on a daily basis. So we'll be diving into that today at 3. So I'll stop sharing my screen. And I will ask if there are any initial questions before I let everybody go for the morning. And
I
there
have a
goes.
question.
Yeah.
So I do have a hard copy of the grant printed out, and just as you spoke about the roles and all of that, with Mindy being the previous site coordinator for this role and her name being on the grant, do we
Yeah.
need to go in and make any changes on the current grant or not
Yes,
regarding all of her
I
name?
think I saw Cindy emailing our contract manager to do an amendment. And that amendment should be in works right now. And that's
Okay.
to replace Mindy's name with your name.
Well, I know her and I talked about it a couple weeks ago, but I didn't know if there was anything on my part I needed to do, or like when the amendments open, is that when I need to go in and make any changes, or is that on you guys or on a different level?
So there was a little delay just because our contract manager was out. But I think what that will look like is that will get routed to Cindy for signature. And then once that is changed in the contract, then we'll negotiate that staffing form back to you guys to make the changes in the grant site to reflect that
Okay.
those changes. Um, and I don't know, that's something you'll have to check with Cindy to see if that's something she wants you to be doing or if that's if she's planning on making those changes in the grant site.
A good question.
A question I have is I'm looking at my username and passwords that I have had or been told to get or have received an email. Is there a way to know Paula's out of office all day at a different county? Is there any way to know if I have access yet to this
To
for the
Iowa
grants?
grants?
Yes.
Yeah, we will. You know what? I have instructions for new users and creating an account. So what I'll do is I'll forward that to you, and we'll just have you connect with our help desk through Iowa
Okay.
Grants, and they'll work directly with you to get you
Okay.
access. So I can do that
Okay.
today too.
And I would be sure to CC Paula in those emails because I
Yeah.
think as
Yes.
the administrator, she probably has to give permission.
Okay.
So I would CC Paula in all those communications
Okay.
as well.
Yeah, and like I said, I was just asking to see if, I mean, I've only met with her one afternoon and she was like, "Oh, we need to do this, this, and this," and I'm like, "Okay."
Yeah.
I don't know
And
how
all
to do
that
it. So
takes-
I was-
and all
I
that
got
takes
that.
time.
I'm only taking care of like what she's told me to or what I've gotten emailed. So I don't know exactly other things that she may or may not have given me access to. Like, I know I have, like, I found going through past things, I have some of the grant stuff and like, so I can kind of flip through it. But I just listening to you as I'm looking and when I was doing the reading, I don't think I have all of it printed. And so I just kind of want to double check to make sure, or if there's things, like I said, I can be doing that I don't need to wait for her.
Yeah, we'll get you connected to the help desk and we can CC Cindy on those
Okay,
those emails. Yeah.
awesome.
Awesome. Thank you for taking your time with me today. I hope this was a good first step, kind of just seeing it in black and white. Okay, you guys had, previous site coordinators and you're working with your project directors. But it's really nice to be able to hear from Amy and myself. This is the role. These are the things that you need to focus on. And we'll just be providing you more information. Hopefully that should be helpful as you get settled into your role. So I'm excited to work with you this week and get you guys going. And if you have questions, let me know, but I will be following up with you, sending the slides. Please reply back if you have questions. And even if you don't, we'll have you reply just to track that we completed our training. And we will see you today at 3. So I will see y'all later.
Sounds great.
Yeah.
All right. Thank you guys
Thank
so much.
you.
See you later.
Yeah.
Bye.
Bye.